Hello and Happy New Year to all of you. My name is Dr. Savannah Clary and I am a member of the Aegis clinical team. I will be presenting today's webinar. If you would, please mute your phones to help minimize any background noise during the presentation. We appreciate your ongoing participation in these webinars presented by Aegis Sciences Corporation. With a new year upon us, it's a good time to take pause and look at a new perspective on kratom use. We will be looking at sample data from Aegis in which kratom was detected along with additional drugs. How does this compare to what has been noted in recent literature? Our takeaways for today will include a brief update on kratom use prevalence, anecdotal discussions of kratom benefits as purported by users, a review of kratom user preferences of other drugs reported in literature and as found in Aegis samples, and where to seek out additional clinical support for questions regarding kratom and other drugs of concern or abuse. Those who missed the live presentation today or would like to hear it again may find a recording of this presentation on the Aegis website at www.aegislabs.com. Please call 1-800-533-7052 if you need assistance in accessing the recording. Let's start today's discussion by giving you an opportunity for a little self-reflection. We'll touch on some of these questions in our brief time together today. What do you already know about kratom use? Do you have patients in your practice who may be using kratom? If so, why might they be using? If they report this to you, what effects do they describe? What other drugs are patients using along with kratom? What other drugs are they prescribed, or what drugs are you seeing on your Aegis reports for these patients? Our first question for reflection was, what do you already know about kratom? For some of you, that may be quite a lot, but just briefly, here's an overview on the basics of kratom. Metragenine is the active component of kratom. The scientific name is Metragena speciosa. Kratom is indigenous to Southeast Asia, where it grows as a tree-like plant and has a long history of use for various purposes such as an antidiarrheal, an antihypertensive, stimulant, analgesic, and even as an opioid withdrawal treatment. The plant's leaves can be chewed. They can also be brewed in a tea. They can be used for development of extracts, or sometimes they're ground and placed into capsules or consumed with various foods and beverages. The effects are dependent upon the strain type and the dose that's consumed, and the effects can range from stimulatory to analgesic effects to anxiolytic effects. Next on our list of questions I pose to you, do you have patients in your practice who may be using kratom? Most states allow the sale and use of kratom. Despite the fact that kratom is currently flagged by the United States Drug Enforcement Agency as a drug of concern, most states do not prohibit selling or purchasing the substance as a dietary supplement, as long as no claims are made about its ability to cure or treat any disease. The American Kratom Association has estimated that more than 1 million people in the United States may be using kratom. With additional emphasis on conservative opioid prescribing and the wide array of kratom marketing, many patients may be seeking out kratom as an alleged opioid alternative or to mitigate opioid withdrawal. Some patients may believe kratom is undetectable by drug testing and are seeking an alternative to commonly detected drugs in hopes of passing a drug test. Online forums and other sources describe a wide range of use patterns by patients who report occasional use all the way up to multiple doses per day. There's a lot more that we could discuss regarding kratom doses commonly used by patients and the reported effects, but I want to move on to our recent analysis of Aegis sample data. On our website, which you see on the screen here, www.aegislabs.com, under the Resources tab, you will find a previous publication from the Aegis clinical team entitled Kratom Correlation. Please contact us if you need assistance in locating this clinical update or if you would like for us to send you the link. The third question I posed was about additional drugs or substances patients are using along with kratom. One way to answer this question is by taking a look at samples analyzed by Aegis that tested positive for kratom and examining which additional drugs or substances were also positive in these specimens. This analysis reviewed approximately 1,500 samples tested by Aegis and found that buprenorphine was the most common co-positive drug, with 32% of kratom-positive samples testing positive, closely followed by cotinine or nicotine at 31% of samples. And then finally, marijuana was the most commonly detected substance after those, with 26% of kratom-positive samples testing positive for THC. Aegis data differed somewhat from a 2017 study by Smith and Lawson, which reviewed lifetime substance use, past 12-month substance use, and drug preferences among kratom users and non-users, and this included a total of 500 patients who were enrolled in a substance use treatment program. Approximately 20% of the patients reported lifetime kratom use. Kratom users in this study showed greater preference for heroin and amphetamines. The individuals also had higher rates of non-prescribed Suboxone use, which, as you know, is a combination drug containing buprenorphine and naloxone, and indicated a greater preference for Suboxone versus non-kratom users. Several demographic characteristics were also compared between kratom users and non-users. However, one notable observation is that kratom users reported higher rates of mental health problems than non-users. This fits with known statistics regarding the positive correlation between substance abuse and psychiatric conditions. Approximately half of all of those with a substance use disorder will experience some form of mental illness in their life, and about 18% of patients with mental illness also have a substance use disorder. While the demographic statistics noted in this study are not predictive of which patients may be more likely to use kratom, the differences between kratom users and non-users are somewhat interesting. Kratom users were younger than non-users. They were predominantly single and most often had a college degree. Also, more kratom users reported homelessness and had more treatment episodes in their past medical history. Fewer kratom users were on probation or parole. However, they did report more separate incarceration instances and had a similar number of overall years incarcerated as compared to non-users. Kratom-positive samples tested by Aegis come from a variety of patient populations and may not all fit the inclusion criteria outlined in the Smith and Lawson study. The co-positive substances could differ based on the patient population and the practice specialty where the samples are located or are collected. Mitragynine has agonist activity at mu-opioid receptors, which may lead to some degree of dependence. This may be of particular concern for substance use disorder patients or those at higher risk of substance misuse and dependence. Serious toxicities are also possible with kratom use, including neonatal abstinence syndrome, withdrawal symptoms, seizures, agitation, and even death. These toxicities could be potentially more serious depending on what substances are used concomitantly with kratom. Before we wrap up, I want to tell you how to get in touch with us for additional clinical support. We are ready and willing to take your calls and emails regarding today's content or any other questions that you may have about result interpretation or drug testing in general. The information covered today is also available in a written form accessible online at www.aegislabs.com. Go to the Resources tab and then click on Clinical Update. At Aegis, we definitely understand your concerns as you evaluate definitive drug testing results, and we welcome your calls and emails for assistance with interpreting results. Please feel free to call our clinical team at 877-552-3232 or send an email to clinical@aegislabs.com. We look forward to hearing from you. Thank you so much for joining us today.